For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Coming up, it's your Pulse Radio Show, telling you all about the QEH. Let me say a very good morning to Shane Seeley.
A pleasant good morning to you, Andre, for the second time. And good morning to all of our listeners, our friends, and well-wishers. Welcome to another edition of the Pulse Radio Show. I'm your host, Shane Seeley, always happy to be with you on a Monday morning. And this morning, I'll get straight into getting into my guests. I have Dr. Greenidge with me, our Chief Operations Officer. She's been so busy making sure that service improvement is high on the agenda. But today we will be helping you to navigate the system, which is the QEH, a complex system. We've heard many calls and been hearing many concerns from the public about, what they need to do in certain departments at the QEH, how they can better communicate with us, and we are here to answer those calls, those concerns, those queries, and in some cases, those complaints. Dr. Greenidge, a pleasant good morning to you.
And a pleasant good morning to you and to all who are tuned in to the show this morning.
Yes, we appreciate it.
I'm pleased to be here.
And I'm pleased that you're here. I know that there were some issues with the phone lines, but you can send us a WhatsApp. So we may not get your calls. Hopefully that can be rectified during the program, because we always love to hear what our callers have to say, what they want to share with us, their stories, their experiences with the Queen Elizabeth Hospital. But in the interim, you can send us a WhatsApp, and we'll definitely get that and respond to your queries there. That number that you can send us the WhatsApp is 434-1007. 434-1007. You can send us a WhatsApp, and we'll be able to respond to your queries, your questions, your concerns, and definitely any complaint that you may have, because we want to help you better navigate the Queen Elizabeth Hospital. So, Dr. Greenidge, as I said, it is a pleasure to have you on, because you've been also receiving many calls from members of the public. Ask you basically, what should I do in whatever event they bring to your attention, whatever situation they raise with you. Talk to us about the complex system, which is the Queen Elizabeth Hospital.
Healthcare in itself is very complex. It operates on nanoseconds. That means changes always occur within healthcare systems. But what we have in common, I think, is a duty to ensure that the public or any consumer of healthcare is in sync with how to navigate the system. Our goal is to decrease the confusion around many things that patients and their families have. But public healthcare globally, we all face the same issues, and one of those issues is complaints. And complaints is something that we cannot ignore. People complain when they're disappointed in either the quality of the service or disappointed in not even being able to access the vital information that they need. So I think the show is all about me trying to narrow that gap of communication between us here at the Queen Elizabeth Hospital and our consumers, our customers, their families, etc.
Yes, recently we responded to some queries about our medical records department.
Yes.
You know, some people come there, they are questioning what is happening to the medical records. One common complaint we get is about missing medical records. Another concern raised recently on another radio show was in relation to getting medical reports. And the question was, why should I have to pay for a medical report for my family, you know, if I want to get a second opinion?
Right.
And that came up. It is something that we confronted squarely. And paying for medical reports, this is nothing new.
It's nothing new. It's been the policy for many, many years.
Yes. So what you do is you pay $375.
Correct.
And the explanation for that, because people confuse paying for a medical report with free health care.
Correct. It's not the same.
And the distinction needs to be made.
Absolutely. So your medical care, whether it's tests, lab tests, CAT scans, inpatient care, is free to you as a Barbadian citizen. The extension of that, which is in the record, the medical record, is the property of the hospital. However, you are entitled to get a copy of your report, and there is a charge because our staff will have to take time from ordinary doing their job every day to copy the medical record to make sure it's intact, and then to secure it to the individual or entity that's requesting a copy of that medical record. And that fee has been around for many, many years. It is nothing new. So there's one thing to receive public health care, right, which everyone is entitled to. But anything beyond that, which is not really connected per se to your inpatient stay today, it could be a request of a medical record from 5 years ago or 10 years ago, and then you could understand what goes in terms of having to retrieve it, make sure it's accurate and up to date and presentable. So that's where the charge goes towards that.
Yes, and towards, of course, paying the hospital for processing and creating that detailed document, and of course the medical professional who has to provide the details surrounding that report. Also, something that came up connected to that is when you're requesting this report, when you're requesting information from the hospital, it is either you do it on your own behalf if you're a patient, or if you are the next of kin of that patient.
Yes, and I really want to spend a few minutes explaining next of kin and what that means in terms of the authority we have at the hospital. Next of kin is the person who that patient or that individual has designated responsibility to make sure that they are receiving the care, or if something goes wrong with them, that person will act on their behalf. That's next of kin. This person will be on the medical record on the front sheet to indicate that Shane Seeley, you're the next of kin of Tom Seeley. A next of kin could be a child, it could be a parent, it could be a good friend as well. In the case of siblings, and I can tell you this is something I face all the time in next of kin, and then entrusting personal medical information to a next of kin. So let's say an individual has 3 or 4 children. Out of the 3 or 4 children, he or she designate one, Mary Q, to be the next of kin.
Right.
So that is the person that the physicians and the healthcare workers will communicate the status, or will answer any questions that you may have, the next of kin may have, around the care of their of the person that they're be designated to take care of. What I find many times when they're siblings, so if Mary is next of kin and you, Shane, is a brother of Mary, then you're coming asking for information or demanding information.
Right.
And then your sister, your other sister, demands information. But understand that you are not the designated next of kin. Yes, you are a child or a grandchild, but you are not the individual on the medical record that we can safely and confidentially communicate the status of your loved one. Always a problem. I find also when it comes down to property involved in the family, whatever discord may be going on, that it becomes even more inflamed. And unfortunately, we have to tell people, I understand, but have you spoken to Mary, your sister? Because she's the person on the medical record, and we've been communicating with Mary all along. So if they're not communicating, the siblings amongst each other, it's also a problem. Right? Then you have some children that maybe haven't been in touch with mom or dad for years. All of a sudden, they come to be the chief person requested information. So our responsibility at the hospital is to protect the private health information of everyone, and above all, the confidentiality of that medical
Indeed.
record.
That confidentiality is critical.
Oh, I just recently was faced with something that I'm glad that my alarm was up. A person had called in requesting a copy of a medical record for a grandchild, and who happened to be a minor, and without any status information. And actually, I think this person went on another show with this scenario, was demanded information. Now, red flags. Minor, grandfather who is not listed on the medical record, red flag, right? And then the reality of the child have two parents, alive and well. So any break in just by hearing grandfather of, if you had just given the information without first consulting who is the next of kin on this medical record. And by the way, there was a next of kin, and it was not this individual. But you see how easy you can become entrapped in relaying information, and my flags go up when I hear minor, for obvious reasons.
Indeed. It is our mandate to protect the health information of patients. Only next of kin, those people registered, those individuals registered as a next of kin on our document, can receive or retrieve the health information of that patient that we are caring for. Any concern related to that, and if you want additional information, if you don't understand that connection of the next of kin, you can we have facilities that you can call. Our patient advice and liaison service, 536-4800.
Absolutely. And another one that comes to mind right away is this is a couple months ago when a patient expired, had passed away, and the daughter, who was the next of kin, received the information, was told what happened, and was offered if you want to come and see dad before his body leaves the unit. And that was okay. We were fine with the communication, but then got a call from a sibling who claims now that he did not know his dad passed away.
Wow.
So you see how when siblings do not communicate, or if one has not been in the family circle for a length of time, it becomes problematic. It really does.
Yeah. So we are trying to help you avoid those issues. We want you to understand what you need to do in such situations, especially as it relates to medical records and retrieving those records, maybe for yourself or for a family member. Again, you can call us at 536-4800, and our medical personnel on that patient advice and liaison service, our PALS or our help desk, will give you the necessary direction. That's where your direction can start. You can also start at our PBX, which is 436-6450. Our team there can also give you direction on where you should go next to get that information.
Yes.
And direct you to the department, which is, in this case, medical records, so that they then can guide you on what the process would look like.
Yes, Shane, you just gave a series of numbers for the public to engage in case they have any difficulty navigating the system. What saddens me is when people choose certain media shows. I can't name, but they some of the radio media shows they contact, and in that forum they're exposing all of their private information, to someone who cannot help them to solve the issue.
I liken it to me wanting help with my personal banking information and taking it to a third party, a radio station, TV station, to ask them to fix the issue that I have with my bank when I can call the bank directly.
Right? Or use some of those customer friendly numbers to contact. But above all, when that happens, and people will call into talk shows, we know.
And that's
some
what
of
they're
them
there
are-
for.
Absolutely. This is what we're here to give information. But I will ask, if you're going to entertain someone who's having difficulty at QEH or even about their personal medical information, it is your responsibility as a responsible journalist to get the name of that person, their contact number, and contact us at the Queen Elizabeth Hospital.
And I want to
Right.
applaud some of them
I'm-
on that note.
I'm-
Some of them do.
Some of them do it. Some of them do it. But others are using it as sensationalism. And I get concerned for the person behind that phone, that person who really needs help, but is not contacting the correct source to be able to get the help they need.
And the worrying part about it is that they're exposing their private health information
Yes.
to the public.
Yeah.
And that is something that we at the Queen Elizabeth Hospital want to protect.
Yes.
Your private health information. Soon, very soon, we are working on our digital transformation where we will have our digital medical records available to the patients directly.
Yes.
Where you can, and we have been sharing the vision, you will be able to go on your mobile phone and you will be able to use a password, your private personal password, to access your personal medical record electronically at your fingertips. That way you can share it with, in any event, your private medical physician, and your private physician may also even have that facility once we can verify that he is that person that is taking care of you, that information can be shared with him at the click of a button. We're not there yet.
We're not there yet, but we're on our way there. And we have to be on our way there because it's a different world. Information is now like this, at the tip of our fingers. And why not your medical information? And let's suppose you're traveling, go to Jamaica, Cayman Islands, someplace, and you have this digital stamp on your phone, access. You can become ill in another country.
Indeed.
How great will that be, Shane, to be able to log on your phone and there's your medical record, there's the latest blood tests, the results, your appointments, and it's the changing world, and this change is so needed in terms of digital transforming medical records and how healthcare is at the tip now of the consumer fingertip.
Yeah, it's a work in
The only thing I
progress.
want to say, though, we think electronics and we think information technology in healthcare. Let's remember the elders out there.
Yes.
Okay, so they too will be accessing, but they will need to have someone in the family circle to help them navigate, or that next of kin person to have a copy of that record as well.
Yeah, and when we get to that point, of course, we at the Queen Elizabeth Hospital will do that necessary public education so that seniors and the general public would not be left behind as we make these digital transformative steps towards making the hospital a bit more user friendly and a bit
Absolutely.
more easy to contact, to be in connection with through this digital transformation mechanism and this process that we are currently going through. So again, we will keep you informed right here on the Pulse Radio Show and through other media so that you know exactly where we are and where this digital movement will take us, and by extension where it will take you and your health information.
Yeah, I just want to add one other positive effect of the digital transformation. And that is any healthcare provider now can have access to the medical record. Right now, we have these voluminous, very long paper records of hospital stays and clinic stays and all of that. And now Dr. X could be maybe in his private office and want to look you up as his inpatient at QEH and can log on to the system and see the information there. So that paper medical record, has to be physically here for someone to access, to write in. Whereas with the digital transformation, that will be gone.
Yeah, and a nice component of the digital transformation that has been introduced already is the sign up, the digital sign up in the accident and emergency department. I saw one of our service improvement managers gave me a picture to look at, something that we will use for our future publications and education in our educational forums. But good to see that transition, so it's a lot easier for people to register as they come to the accident and emergency department.
Yes. I like to use an analysis where I think everyday folks can understand what that means in terms of self-registration in the A&E. So many of us travel. Right now, you can probably recall many years ago when you came back in to the country, you had this long queue, and you had to wait on the immigration officer.
And you filled out the card on the online. I mean, you fill out the card on the plane.
On the plane,
you
right?
Get this
so
card.
They're set. And if you haven't, right there, have a kiosk now. You slide in your passport. It takes your picture. Boom, boom, boom. You go straight up to the immigration officer.
Right.
So that's a digital and timely transformation of how we used to come in back into immigration. Indeed. To be checked back in. So I think people could understand that in terms of what it means to be able to register yourself in the A&E and not have to wait on someone calling and yelling your name out, etc., etc.
And again,
it's so exciting.
Yeah, and again, another example, I thought you were going to go with this one, the banking sector.
That's my favorite too.
The teller machines. Now we can do so many different forms of business at the teller machine.
And it has become so normalized. Take it away and see what happens.
Exactly.
You want to be in that long line when you used to get paid with a check, that
no
long
way.
queue, waiting for your paycheck?
No way.
Oh, you just go to the ATM. Actually, you log on your phone in your banking system, and there it is. So, change is hard sometimes. In healthcare, if we don't change, we remain stagnant and we don't progress, right? And progress is everything, a goal that everyone want to make sure is there for us to realize.
Let's speak about change and managing those processes and procedures. One bit of good news is we've been doing our best to boost our blood bank. And we have 3 blood drives coming up, actually. And I want to really use this opportunity to thank those partners who've signed on for these blood drives on multiple days. Ross University, we salute you and the team there. They're doing a blood drive on October 10th and 11th. PricewaterhouseCoopers, PwC, they're doing their blood drive from October the 13th to the 16th. And Bajan Sigmas, we can't leave you out. We thank you for coming in, or we thank you on you're looking to come in now and donate blood to our blood bank. They're doing it on October the 23rd. And all of this is ensuring that we save lives, ensure blood availability, helping in the event of an emergency, and really it's a national contribution. It's a national contribution to help boost our blood banks, because blood is critical for the work that our doctors do in the emergency department and elsewhere in saving lives.
Yes, and when we have those trauma cases, such as gunshot wounds and stabbing wounds, you can imagine the blood loss. So those type of patients extremely need to be transfused when they come upon the A&E. So yes, absolutely. Yeah. And I just want to add to that information that there are rare blood groups such as O negative, A negative as well, that are rare, and people who donate to those blood types are always needed to donate.
And they respond to the call as well. Recently we made a call. We were asking, for those rare blood groups that you mentioned. We wanted those individuals that we have a relationship with to come in and give us that donation to help rebuild our blood stocks for those particular what are rare blood types.
Yes.
And they answered the call. They came in and they did just that. And then, I mean, if you know for a fact that you are in that rare blood group and you want to donate, feel free to head down to the blood bank. It's right next to the Winston Scott Polyclinic, not a stone's throw away from the hospital. Very easy to find. You just go there. Our manager in that department, Wendy Lord, she's been very busy.
Very nice staff there.
Yes, she will definitely take care of you. Just make the journey there and give of your time, and please give blood, because it's a necessary resource that we need to continue to serve some of our patients at the hospital, especially those trauma cases, and as you mentioned, those who would have been involved in altercations or anything like that, accidents. We use a lot of blood.
Yes.
And then there's platelets, and this is in your region now, where well, you would have to explain it. I'm non-clinical, not a clinician, but they do a lot of specialized work in the blood bank, and connected to that, the lab as well.
Yes. They're all connected together in terms of our own blood bank, as well as our laboratory systems. It's just not the whole blood. The platelets also can be donated. Very important in terms of preventing bleeding, for example. And we have so many types of patients that are in need of blood, but when we get to a level where our stock is not where it needs to be, that's the appeal that we go out. That's the responsible thing that we must do to ensure that those units are readily available.
Indeed. We'll talk a bit more about that when we return after this break. I just want to remind you again about those blood drives. They are coming up on the 10th to the 11th of October, Ross University, PricewaterhouseCoopers, October 13th to the 16th, and Beijing Sigma's October 23rd. And don't be afraid. We'll give you that information you need about how you can donate blood. It's on our website as well at www.qehconnect.com, and you can find out there all that you need to know about how we go about accepting those great donations. We're very happy to do just that. We'll take a quick break, and a big thank you to our sponsors, MedSafe Medical Supplies, for sponsoring another edition of the Pulse Radio Show.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmet's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Pulse Radio Show. I'm Shane Seeley, Communications Specialist at the Queen Elizabeth Hospital, alongside Dr. Christine Greenidge. She is the Chief Operations Officer at the QEH. And just a few moments ago, we were talking about those donations of blood, how critical they are for our teams at the Queen Elizabeth Hospital in treating to our many patients who come in with a variety for a variety of reasons. And it's for a variety of reasons that they would need to have those blood transfusions. As far as the donation side of things, there are some people who can readily give blood, but there are some people who cannot.
Correct.
How do we make the distinction, Dr.
Well, the distinction is made when someone comes in and wants to volunteer to give blood. They have to be screened. Very important. They're screened before they can donate the blood. But if you know you have a history of, let's say, I would say immunocompromised, meaning that your blood counts are typically low. You may have a history of anemia, right? Which is red blood count is very low. The people such as with these disorders will not be ideal candidates for blood donation. If you're on certain medications, for example, I would say any type of chemotherapy medication. There's some medications such as statins and other cardiac meds that will put you in a position where you will not be ideal to make the donation. Recent illnesses as well. You will have to wait a couple of months, but someone, for example, and a great point made here in the studio, if someone had recently have tattoos, everybody's tattooing all over the place, but recent tattoos, because it does involve the skin, right? Needle into the skin, you will not be an ideal person to donate blood. So typically the healthy individual with no compromise in terms of their blood count, we look especially for the red blood cell count and making the donation for pack units of red blood cells for transfusion. Right, so you double check, and I will always say, you check with your doctor. You know what your illnesses are. He or she can best advise you in terms of your ability to donate.
Yeah. So again, you can always make that trip to our blood collection center, and we will definitely Wendy Lord, she will take care of you, and she'll make sure that she tells you, if you can or cannot donate blood. There are some people like one of our good friends, John Wilson. He is a record donor, and he has donated the most times to our blood bank. And there are many people like him. They would not have donated as much, but they're trying to do their best to continue to keep our blood stocks up. Some people are serial blood donors.
Yeah.
And we're happy for that. That's a good thing.
That's a good thing.
That's actually a good thing. Some people live, and they just feel that sense of that is philanthropy.
Yes.
In itself. And it's the gift of life. It definitely is, and we appreciate that, and we salute all those who come through our doors, especially at the blood collecting center, to do just that. So in navigating the system, one other challenge that we had recently that we responded to and we got solved was that challenge in hematology. We were in a situation where we were suddenly without a consultant running that department. That consultant chose to resign and pull his services. But our team, HR, and the Director of Medical Services, Mr. John Gill, we must praise him for his steadfast commitment to solving this issue and dealing with those patients in the interim while we were without a consultant in that department, to get hematology back up and running with its full complement of staff. And I'm seeing that things are working pretty smoothly. We have had no more concerns raised relative to hematology.
It was a challenge. It was an unexpected occurrence that we really didn't see happening. And yes, that consultant chose that given day, June 25th, to say that I'm done. I'm finished. Professionals will give you ample time to seek replacements. Professional people will do that. They will not put a population of patients at risk in their healthcare status by you deeming that you quit today. And I know the public has been concerned, but there were things that happened that at the time we could not share because it was just so stunning. And on that day, I interviewed 4 patients who ventured up to administration. Big grown 3 men and 1 female with tears in their eyes. Right? These are the most compromised people because hematology, is like cancer of the blood and other blood-related diseases. And for me to witness these big grown men and this female in tears because they were just told, I'm done. No more hematology clinics, which we conduct 3 days a week. Just like that.
Right.
I will say a professional person will resign 6 weeks, 4 weeks, 5 weeks, to give us the opportunity to rapidly replace. Hematology is a very, very, very hard to fill clinical specialty because of the nature of it. And having to face those people to this day has been very hard for me, because I just don't know where Hippocratic oath is made that you're going to take care of people, and you thought it was fine with 25 people waiting for clinic that morning,
Yeah.
that you say that.
And no.
I can only talk about this now,
Right.
right? Because the outrageousness of it on that day was not my focus. My focus was on those patients and their ongoing care.
Right. So now we're in a position where we can say everything is back to normal. We have a new consultant in Dr. Alexis.
Yes, who previously worked for us, and we have 3 senior house officers that are working with her. I'm pretty sure the backlog of appointments is either completed or near completed in catching up with those patients who endured. And I think, Shane, the biggest thing that we did, along with CEO Mr. Clark, yourself, and the hematology team, is that public town hall meeting, where I think turned the wave at the time in terms of us infusing timely information, being real about what happened, being transparent about what happened, how our hands were tied. But there was a way formulated. We kept in touch with our patients. I know a couple of them, went on the media, and rightfully so. It's your health, and you're concerned about your health.
Yeah. And as you said, we were very transparent. Mr. Clark would have led that meeting along with our acting director of medical services, Mr. Gill. I was also in attendance, and what we did, we just tried to connect with those who were affected, make sure that they had contact information for us where they could call to get information directly about the hematology clinic, what would happen as far as their treatment was concerned in the interim. And they were allowed during that meeting, Dr. Gill, Mr. Gill, he would have held a consultation where he would have seen the patients and helped them to continue any treatment regimen in the interim until we have a situation like we do now, where we have the full complement of staff.
That's a professional.
All is well.
He's the epitome of professionalism. And I must say also that Dr. Siripathy, who was an oncologist, also took time to review medical records and the current state of some of the patients. So we pool our internal resources as best as we can to ensure that this saga would last as long as we thought it would. Thank goodness that there were people, caring professional people, concerned with this patient population, and all hands came together on deck to ensure that the transition happened. We're about to recruit a new hematologist as well, so the ongoing recruitment is there.
Yes. Navigating the system continues here as we speak about helping people to understand using the Queen Elizabeth Hospital. Another area that we have been really trying to get more people go the direction of is our medication delivery service.
Oh dear.
Yes. So the medication delivery service came up during COVID when people couldn't make their way to the hospital. So we found a way, an avenue to get the medication to them. Since then, the service has really picked up. We're delivering, in some cases, more than 100 packages of medication daily through our couriers, and it is really working well in terms of helping declutter the hospital. You come to the hospital because you need to come there. Some of the elderly population love to come there and just enjoy that time away from home, fraternizing with some of their friends that also come for medication as well. But for the most part, we would prefer that we deliver the medication to you. It helps save you time and can help save you money as well. And there is an easy way to sign on to our medication delivery service, which I'll tell you about in a matter of moments. But this delivery service, it's a real game changer for us at the hospital, and it allows us to really get our patients to understand they need to take the medication in the first place. because we've had cases where we're seeing people in the accident and emergency department who are failing to follow that medical advice as far as just taking medication is concerned.
Yes. We see a lot of that, especially, unfortunately, in two populations that we don't want to see this in. And that is our patients who have a history of cardiovascular and or heart disease, are diabetics. And many times when they come in with that blood pressure elevated and you ask a simple question, when was the last time you took your medication? And they will tell you, oh, I ran out 3 days ago. So running out of medication means that that blood pressure, the blood therapeutic threshold of the medication is now lower, so your pressure is going to go up if you're not taking your medication. So what I like about the home delivery system is just that. At least a minimum of 5 days before you're due to run out of medications, we're already there to do your refill, right? So your refill will be done. It's going to come to you in advance of you running out of your medication. Number two, the timeliness, you can't, there's no ifs, ands, or buts about the relevancy of it being timely. And thirdly, to come into the outpatient pharmacy, Shane, you've seen that area very cluttered, lots and lots of people there for medication, and sitting and waiting to get that medication in real time. Many times they're there already out of the medication, so this is what they do. But I must say also, it's a fee of $10 for the delivery, payable to the people that bring it to your door, right to your home.
Roughly 2 bus fares and a bit.
A little bit, but time is of essence, and timeliness is so important in having that medication on hand. So I try to, when I observe that sitting area and outside of the sitting area where the outpatient pharmacy is, there's a lot of people. Everybody has a cell phone, so they can at least register, right, and get contact about their medication. But yet, there's something that I've observed that I think is relevant to some people, and that's the social aspect of being there.
Don't hold that thought. We'll take a quick break. The Pulse Radio Show brought to you compliments MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
We're helping you to navigate the system, which is the Queen Elizabeth Hospital, right here on the QEH Pulse Radio Show with Dr. Christine Greenidge, our Chief Operations Officer, and me, Shane Seeley, Communications Specialist. Dr. Greenidge, you were speaking about that social aspect when our patients are coming for medication and they prefer to come into the hospital rather than opt for what is an easier solution, the medication delivery service, just a fee of $10 as you mentioned.
Yes, I think there's a social aspect for many people who are there, especially our older patients. They know each other. Sometimes I think they even call each other, we go to the hospital today, and it's a little social hour or two for them. And I think that's important. It's saying something else, but certainly for them, many of them, it's a day out of the house to acquaint with people. A lot of people live lonely lives, and there's a social aspect to it, and I don't know if we'll ever be able to convert these people to home delivery, but certainly though, if I was a child, a son, a daughter, a grandchild, a son, and you see grandma and mom getting older, you would take on that responsibility of enlisting them, enrolling them in a home delivery service. I think it's very important.
Very critical. And if you want to be a part of that movement, to place your order for repeat medications through the medication delivery service. Remember, it's a 1 month supply of medications as prescribed. You can complete, there's an online form, and I'll tell you, well, you know where to find that really, at QEHconnect.com, or you have the option of calling the pharmacy department at 536-4804, and this is from Monday to Friday between 9 a.m. and 3 in the afternoon to place that order. And then when making your request, you provide the patient's name, the national registration number, or the QEH hospital number, the preferred delivery address, 2 current contact numbers, and the names or the name of the medication or medications that are to be provided. Patients are also reminded that medication delivery requests must be placed at least 3 to 5 business days prior to the start of the date of repeat medication. So please, you can find these instructions on our website as well at www.qehconnect.com. You can click medication delivery under the services tab, and you'll be able to find the information there. Actually, there is a medication delivery tab on the homepage. You just click there and it will take you to all the information that you need about our medication delivery service. And this is another facility, COO, that we can also get another direction, and this one falls directly under you, the help desk. The help desk is the number we ask you to call when we see a surge in the accident and emergency department. When we're dealing with a number of patients trying to decant A&E, we ask you to, if you're unsure about if you need to come to the hospital, you can call 536-4800, and that number, I repeat it all the time, the Patient Advice and Liaison Service. Through this facility, which is managed by a medical professional, you can get any information you need about your health status. You can talk about how you're feeling, the symptoms you're experiencing, and that medical professional can help direct you for your next course of action. Whether it be accident and emergency, we can call the ambulance for you. We can also direct you to the 24-hour Winston Scott Polyclinic. We can also direct you to your private medical physician if you so choose, because at the end of the day, if it is not a critical emergency, you really don't need to be in the accident and emergency department. But if you're unsure about your situation, you can call the help desk. That's why it was created.
Yes, and I think also, especially in the A&E, that when patients are there, they may see someone coming way after they did. And, recently I spoke to a lady about that and said, I was here since so-and-so, and somebody came in, she just left and got through before me. So there's different categories of patients in the A&E, and they're all under what we call priority care, right, in terms of triage and which level that person is presenting, and therefore that presentation dictates the level of care that that person will need. So we cannot, by law, turn anybody away from coming into A&E. So whoever comes in, we must see, triage, and treat. Treating could be in A&E care. It could be see and treat, where we see you and treat, or it could be a referral back to a polyclinic, for example, because their presentation does not warrant an emergency situation.
And the name of the department speaks for itself.
Absolutely.
Accident and emergencies. So again, if you're unsure, you know where to call. The Patient Advice and Liaison Service at 536-4800. And what helps the flow in accident and emergency are our patient flow, our officers. We have patient flow officers now in the department to help really improve the flow. How has that been going, and what kind of feedback have you been getting from them in terms of identifying what needs to be done to direct persons along that path, which is accident and emergency?
Right. So we recently, we had only one for a while. We have now 3 in training. Our patient flow officer there, Miss Mears, is doing a great job in training these new staff to be patient flow officers. And how they do, they look within the system to see where bottlenecks are, to see where things maybe are not processing in the direction that they need to be processed. And then they try. You can. The analogy there is like air traffic controller. If you have multiple planes about to land at one place, one at a time, you go through distance and all of that before you determine, who will land first. And so they try to navigate the traffic flow of patients and ensure, for example, if a CAT scan is ordered, if an X-ray is ordered, a blood test, that these critical diagnostic tests are done to enhance the patient's stay throughout the A&E.
Indeed. So it helps that we have those flow officers so that we can help to speed up the process too.
Yes.
And that's how even during those surges that we are able to bring down bit by bit the numbers who are waiting for treatment
Correct.
in accident and emergency department.
Right. And one of the biggest bottleneck, and it's not only us, it's emergency rooms throughout the world that are very, very busy. And you reach that capacity where you just don't have the inpatient bed to be able to transfer patients from waiting in A&E to the wards to the inpatient units, and that's multifactorial as well. So it's the number of patients.
Yeah, indeed. So a lot of things that are happening at the hospital that we want to share with you, because at the end of the day, it's all about making the process a whole lot easier. It starts from the beginning too. Our security team, they have been trained, and for anyone who got to see Morning Barbados this morning, which I had the pleasure of hosting, we would have shared one of what is the newest techniques that we are using to help address something that we are seeing happening in society. Our nurses are on the front lines. You are a part of that profession, Dr. Greenidge. You being not only a registered nurse, you're at the top of the profession where you have that doctorate in nursing. But what we're seeing now, we heard about the situation at one of our polyclinics where the nurse was allegedly assaulted. That is being investigated. And we saw the unions call out the nurses to have that meeting to see what the concerns are and how those can be addressed. We at the hospital being proactive. We have been engaged, actually. They reached out to us, this Barbados Brazilian Jiu-Jitsu Association, led by a nice man, Mr. Don Whitfield. He reached out to our CEO, Mr. Neil Clark, and quickly we had our staff doing training at the studio there in Warrens. Great opportunity for them. Self-defense training for situations that can happen in a healthcare institution.
Yes, public demand is public demand. A lot of people have a mindset of, here and now, right now. I'm entitled. Right away, it's me, while there are many, many other people around in need of care as well. But one of the biggest defense mechanism to protect self and protect other patients is learning how to de-escalate a situation, right? Being mindful of distance between you and myself, right? And also scanning the environment to see where is a safe place that I can retreat if I'm faced with this confrontation.
Reading the room.
So reading the room, we call it also in healthcare general survey. You look around. I could look around here in 1 minute and I could have an idea right away what's happening here, there, and there. It's training, general survey, especially in an emergency room. You kind of feel the pulse right away and know what your priority is. But out of the blue, let's getting back to public behavior and people. This is very unfortunate what happened here with this nurse. And we, not only nurses, it's all healthcare workers. We are at the forefront of dealing with the public that we don't know. We don't know what level they're coming in, their mental status. There's a lot of mental illnesses going on now in the communities. And so we have got to be always on our guard to understand what's happening in the society, but also being mindful of staying safe, protecting yourself, and then protecting your patients from whatever may be in front of you.
And it was good to hear because the de-escalation doesn't only involve physical tactics to make sure that the patient, their anger or their demeanor is addressed. It starts with that communication with the individual involved. So as Mr. Whitfield was explaining, you use a certain type of language to de-escalate the situation. And
your tone.
Yes.
If somebody's coming in front of you and they're irate, you've got to just tone it down. I've used strategies in the past in dealing with my patients. If somebody's yelling and screaming, I just would say, I cannot hear what you're saying. I can't hear what you're saying. If they yell and scream, I can't hear what you're saying. It stops them. What do you mean I'm yelling and you don't hear? I can't hear what you're saying. And that is a tactic that I found work for me many times when people are yelling and screaming, because it stops them. What's wrong with you? I'm yelling. You're not hearing me? But yes, there are techniques that we have to be more mindful of because of the society at the time that we're living in.
Yeah.
Safety is paramount.
Yes, and we're trying to make sure that not only the staff are safe, but our patients and those who are perusing, they're making their way through the network of the QEH, those visitors who come in to visit patients, family, relatives, or friends on our wards. So it's all about ensuring a safe environment at the hospital for everyone. That's all we're trying to achieve, and we're just being proactive in having our staff, not only the security department, those security officers, also our nurses, but ancillary staff as well, even the doctors, having that training for any eventuality where they can address situations that are turning sour, going in the wrong direction.
Yeah, a lot of these techniques have been used for many, many years in psychiatry, right? In psychiatric centers, hospitals, de-escalation, and if you think of the patient population in a psychiatric setting, whose mood swings can go left and right in a minute, the majority of staff tends to stay safe because they're trained at a level where they know how to de-escalate, they know how to take the survey, they read the tone, they watch their tone in which they communicate as well.
Yeah. A lot covered today on the Pulse Radio Show. Dr. Greenidge, a big thank you to you for coming and helping our listeners navigate the system. We're sorry that we couldn't entertain calls today because of some challenges with the network, but hopefully next time we're here on the Pulse Radio Show, we have that facility sorted so that you can connect with us. Any final thoughts that you want to share with the public?
I just want to say that the Queen Elizabeth Hospital, we're here for you. We are entrusted with your care, and we ask that if you have any difficulties, please contact us so that we can be of better assistance. Yes,
contact us directly, preferably, and we will definitely try to answer not only your call but your queries and address your concerns. We want to be there for you so that we can get better together. You can get better, we can get better at serving you. We all can get better together. The mantra of the Queen Elizabeth Hospital. Again, thank you, Dr. Greenidge, for joining me on today's show, and thank you, listeners out there, for spending the time with us. We'll be back with you next week right here on Q100.7 FM for another edition, episode 8 of the Pulse Radio Show in this season 4. See you then.
The QEH Pulse Radio Show brought to you with the compliments of MedSafe Medical Supplies.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.